Hello, my name is Carlia Dorsey, a student at Veterinary Science, and today I'll just be explaining the equipment that we use in our surgical room. This is our surgical towels, our surgical mask, our surgical cap, and our surgical gown, in which we just put on, and our surgical gloves, in which we wear when we're about to do the patient. Right here we have our rope where we would tie down the patient's limbs and arms to get them positioned for the surgery. This is our surgical gauze and our this is the suture, in which it can be absorbable or non-absorbable. This is a needle. These are our instruments, which I can just explain right now. The spay hook, and it holds the uterus up for the spay or neuters. This instrument is a scalpel blade holder. These are the tissue forceps. These are the towel clamps. These are the towel clamps, and you would just clamp. This would say these were 2 towels. You would just clamp it down and just on the drape, not the actual patient. So I just leave those open. Obviously, these are the needle holders, in which they can also be used to cut the suture. This is a curved hemostat, and this, where's the straight hemostat? This is a curved hemostat, and this is the straight hemostat, in which they use to stop bleeding if the patient is bleeding. This is the autoclave, in which it uses heat and pressure to sterilize the material. Steam. Okay. Sorry, steam and pressure to sterilize the material. And you will know it's sterile when the autoclave tape has black lines such as these. And to pack, you can either use the actual packing, such as this one, or a packing tray. These are just 2 packings you could use. And show the tape. And the lines. And this autoclave tape, it has lines in it. If you can or cannot see it, it's lines, and once it's sterile, it will turn into this, like that. Anesthesia. This is the induction chamber, where the patient, if they are crazy or can't be handled, they will inhale the anesthesia. After you clean off the instrument, you would place it in the surgical milk to help with rusting. This is the mouth gauge, in which you would hold the patient's mouth open, such as this. And this is the endotracheal tube, in which you would just place inside the patient's mouth, such as this, or such as this one. You just slip it in there, and you would take the syringe and blow it up. This is the Elizabethan collar, which you see most dogs after surgery is placed over their head, such as this, so they won't mess with the suture material and could possibly infect it. Thank you, and that's all I have. Bye-bye.